Tell us, how is your relationship these days with the House Speaker, Ron Mariano?
It's great. We speak regularly. We actually had dinner this week together. We talk about...
Hasn't always been great.
Pretty much, yeah. Yeah, we've always talked, there are differences which are to be expected, but we talk about them, we work them through, and the relationship is great.
Well, speaking of differences, a sweeping House gun bill ran into a bit of a roadblock in a procedural dispute in the Senate over which committee to send it to. It would modernize gun laws and tackle those untraceable ghost guns, which we've done our investigative team a lot of reporting on.
Thank
you.
The
House then had to deal with dissent between its own members about the bill. Is that bill dead on arrival in the Senate? And what will the Senate be doing on gun control in the coming couple of months?
Well, the way the legislative process works is usually one branch does its own version of a bill and sends it to the other branch, and then that second branch does its own version, and that's what is happening now with the gun. It's the legislative process. So the House worked on its own bill, and as you noted, they pulled it back, and they're continuing to work on it this fall. The Senate is working on its own version of a gun safety bill. I'm proud that we have among the strictest gun safety bills in the country. I believe we can make that stronger, though, to protect our residents.
And could it happen this fall, do you think?
Oh, yeah, this fall. I believe this session, and we'll look at ghost guns, we'll look at more data collection. There's also something called Glock triggers that might be important to take a look at as well. I'm hearing from some of the members, but we're meeting with members, we're meeting with advocates and stakeholders, and we're working on our own version of a gun safety bill, and we'll make sure that it's the strongest bill in the country.
It would be remiss, though, if we didn't mention the procedural roadblocks this House bill faced right at the outset. That's typically not, for people who don't watch this as closely, that's typically not where the roadblocks happen, is assigning it to a committee. Why was that so hard?
There were differences as to where it should go to, which has happened in the past. We believed public safety was the jurisdiction for gun safety bills. There were over 40 gun safety bills there. It's important to me to ensure that bills have a hearing, a legislative hearing, once they go to a committee before we take them up. It makes the most sense. Let's hear from the people, the stakeholders, the residents on all of the issues. Let's learn more about the pieces that are in the various gun safety bills. So, I believe that that's a really important process, and it is the foundation of our legislative process.
Briefly on prescription drugs, if we could. The White House just released a list of 10 popular drugs that Medicare will now be able to negotiate on. The list there is on the screen. What can Massachusetts do to try to further lower health care costs, which we know are so high?
Right. Well, that's a great question, because the Senate has done a prescription drug bill to lower the cost of prescription drug in the past, and we will do another one this session. Now that the federal government has done, something more, we will work to intertwine them together. And so I applaud the Biden administration for taking some steps to lower the cost of prescription drugs. I do believe that we as a state will do better. We'll pick up the bill we did last time. We'll look at what the Biden administration did, and we'll make it even stronger, because I'm still hearing, especially from seniors who are struggling meeting their costs, and prescription drugs is something that is critically important that they take.
Are you able to get the House on board? Because this is something the Senate has taken up in the past, and that's where the problem has been.
Well, I'm hoping the House, will do it as well. I think the Speaker is very strong in health care, and we'll continue to talk about it.
Our thanks again to Senate President Karen Spilka for being with us this morning. We appreciate it.